This video will show you how to unpack and set up your BiPAP machine along with your oxygen concentrator. We're going to start with your bag. You're going to unzip. You're going to find your mask here. We'll put that to the side for now. You're going to move your machine. Get your BiPAP connected to the humidifier. Parts you will need to clean. There's an air filter, which you'll see if I turn the machine, is in here. Once a week, lift up the door, remove the filter, and you're going to rinse off the white cottony kind of bottom here. Once a week, just some warm water will do it. Leave it out to dry. When you place it in, it will not fit in the wrong way. It will only slide in correctly. So that is your air filter. Next to that is an SD card, which you'll leave in place at all times. For the humidifier here, if you choose to do so, you'll be adding distilled water. If you do not want to add the water, that's fine. I'll show you how to make sure your heat setting is off. We don't want the heater on without water. So what you would do to access the chamber to add your water would be to pull and hold that latch, which is unlocking the lid, which you can lift up here. Remove this container before filling. Do not spill water on the unit. Bring it out by your counter. You're gonna add your water right through the big opening on top, pour it right through, and you'll see there's a max line there. Do not go past that dotted line. That's your fill level. Change the water daily, so whatever water is remaining, you're gonna dump it in the morning, add fresh water the next night, and wash this once a week. You can put it in the dishwasher, top rack, that's fine. Or washing by hand with soap and water is fine. Any hand soap, dish soap. This metal disc is the heating plate. So if you're not adding water, you want to make sure that is not heating up. I'll show you that in a minute. When you place your water chamber back in, if you happen to place it in backwards here and don't realize it, you'll just see the lid won't close. It only fits in correctly. Place it on the track. Give it a little good push down. You want to hear it snap and click in place. Yeah. Okay. So what we did, we pulled and then lift. Good push to lock. Never lift or move this with the water remaining inside. Any tilt could spill and damage the equipment. You want to be very careful with that. In your bag in the pocket here, you're going to find your tubing. I'm not going to open yours. I have tubing here for use for the demo. These two rubber ends are exactly the same. It doesn't matter which end connects to where, the machine or the mask. You want to clean out the inside of your tubing once a week. For this, a lot of people do in the shower. Drop a soap, hand soap, or dish soap, just a little drop. Flush out some warm water, rinse it, let it hang dry for the day. That's once a week. We're going to take this little adapter, which allows us to bleed in your oxygen with the BiPAP. That's going to go on this little nozzle here. One on the rubber tubing, pushes on here. When you go to remove your tubing next week, do not pull here. You're going to tear it. Bend side to side, wiggle off using the rubber end. Okay? And again, it doesn't matter which end connects to where. We're going to take this nipple here and attach this clear tubing, which will go from your BiPAP to your oxygen machine. So one end will push on here. There. And then the other open end here is going to go to your concentrator, which I'm going to probably do in a separate video so we can email this to you without any problems. So one end here, push on firmly. Other end to the concentrator. Power cord. There's only one spot that'll fit into. You can see it says a little green end here, which goes to the right side here with a green. Only place it could possibly fit. Plug it into the wall. Only a 2-prong cord. Okay. So you have 2 buttons here. That's your power, large space bar. Okay, on and off, obviously. Little triangle button here. That's known as the ramp button. If you find during the night the machine's blowing too much air, it's a lot of pressure, it's uncomfortable, you can push that and slow the pressure down temporarily. It'll build back up to what it needs to get to throughout the night. So this is an auto BiPAP. Each night the machine's going to auto adjust based on what your body needs. When you turn it on here, a little push, machine starts up. It starts on the lowest possible pressure for you, okay? Try to see with the light here. In the bottom right corner is a number 3. That's your heater setting, which is adjusted by turning this dial. If you're not going to add water, you must turn it down to 0 so it doesn't heat up on you, okay? The higher the number, the warmer it gets. If you're waking up with a dryness, a dry nose, or dry throat, you may want to increase that number a bit to help with more humidity, okay? The higher the number, more humidity, more moisture. When the machine's been running for a few minutes, all the lights are going to go out, just so nothing bothers you in the dark when you're trying to sleep. It should be relatively quiet. You hear a little air as you're exhaling. But if you hear a lot of air, kind of like that, you got to adjust your mask. Perhaps you didn't close the lid all the way here. But as long as there's a good seal, the machine is relatively quiet. So you have power, on and off, ramp reduces the pressure. In the morning, when you press the power button, that lights up, machine's off. This is the type of mask you're going to be using. Again, this is a demo mask. This isn't yours. Yours will be all packaged and sealed. Rubber in the tubing connects to this adapter here. This type of mask allows you to breathe through your nose or your mouth. You're going to wind up with the top straps here above your ears, bottom straps are below the ears. Everything is Velcro adjusted. Get this set up properly. Okay. You have this on the forehead, nose and mouth are covered. Clean your mask every day. Wipe it off gently with a washcloth, some soap and water. There's going to be air blowing out of here, which is normal. That's your exhalation vent. We want the air escaping from here. White adapter quickly disconnects. You want to run to the bathroom with your mask on? You go, come back, snap it on. In the morning, use one of these clips on the bottom to remove your mask. You're going to bring it forward halfway and then turn it like you turn a key. So the next night, the Velcro setup for you. Pull over your head, get your strap set up. You're going to stretch it forward and press on here, which is easy when it's on your head. You're going to take it, snaps in place, and morning, remove. Snap back in place. You do left or right side, won't make a difference, okay? Never eat a large meal and go right to bed and put this on. Always wait a half hour, make sure your stomach is settled to digest. We don't want you to have any stomach issues throughout the night where you're getting sick with the air. If I push this white button here, you could bring this piece back and forth. That's the piece that's sitting on your forehead. If it's too much pressure on the bridge of your nose, a little push on the white adapter here and a little button, you can move that back and forth for you, okay? So it's a full face mask which allows you to breathe through your nose or your mouth. It's going to sit on the bridge of your nose and cover the bottom, your bottom lip, okay? So based on your sleep test, use the size medium, this type of mask here. If the mask is uncomfortable, you do have a 30-day exchange period. You call us directly and we can help you out and see what else would suit you more comfortably.